Welcome and thank you for joining us for tonight's webinar, Anxiety in Children. My name is Sydney and I'm from the PHN Education team. Tonight I'm joined by Dr. Meena Rattan, who's a staff specialist at Wyong Pediatric Assessment Unit, as well as Olivia Gregg, who is a clinical nurse consultant with CAMS. Before we begin, I'd like to acknowledge the traditional custodians of the land that we live and work on. For me on the Central Coast, that is Darkinjin land. And I'd also like to pay respect to elders past, present, and emerging. Now, a few housekeeping things about tonight's session. It will be recorded and available for you to view in our PHN library in a few days' time, as well as a copy of the PowerPoint presentation slides. As attendees, your camera and microphone are automatically disabled. However, if you do have any questions throughout this presentation, please just pop them in the question box, which is located within your control panel. And at the end of the session, an evaluation will come to you. It's so important that you fill this in because it allows us to provide future education sessions as well as upload all of your RECGP. Tonight we have 1 hour of EA that we will do for you automatically. But if you have any other questions, just pop them in. Now it is my great pleasure to introduce our speaker for tonight, Dr. Meena Rattan.
Thank you so much, Sydney. So thank you everybody for joining the session. So today we are going to talk about anxiety in children and with a special focus on younger children, that is less than 12 years of age. And as primary care providers, I'm sure you see a lot of children with behavioral issues and anxiety in your clinics. So it will be a great opportunity to have this discussion. So first I will start with a case, which I'm sure you have seen in your clinics quite often. Roger is a 7-year-old boy who is in year 2 at a local school, who is struggling with his learning, and mom reported that he's unable to focus and concentrate on his schoolwork. And the teacher report which you received further mentioned that he struggles with literacy tasks, social relationships, and is also falling behind with his reading levels. There has been death of his grandmother recently, to whom he was very, very close. So you see that there are a lot of situations which are going on for young Roger, and as a clinician managing him, it becomes really important to have some differentials. And as you can see that he's struggling with his learning, so it does cross your mind whether he has got any sort of learning difficulties. And if focus and concentration is an issue, you worry about ADHD and specific learning disorders like dyslexia. There is mention about social relationships, so you worry whether there is an element of autism spectrum disorder. Plus, there is grief as well, and these kind of situations can impact indirectly with learning for a child. So basically, as we move on to the next slide, you can see our thoughts are focused around these differentials, which I just mentioned, which could be learning difficulties, ADHD, ASD. We need to keep in mind any environmental factors, which we need to go more in detail, family situations. And of course, as clinicians, we never forget about medical causes, which can explain some of these conditions. And of course, last but not the least, we do need to keep in mind a generalized anxiety disorder at the bottom of these issues. So as you know, the anxiety is seen in all ethnic populations. So the prevalence rate is variable in different countries, but roughly speaking, it is around 2 to 4%, and in younger children. But if we increase the age group more than 12, it reaches up to 9 to 12% in certain groups. So there are different studies which have calculated the prevalence differently. But anxiety, as you know, remains both environmental and genetic, and often there is a strong family link. Children are more sensitive to change and stress, so we need to be mindful of that. Use of devices and computer games, as you know, is increasing. Everybody is into social media, especially with COVID. It wasn't very helpful, and children were unable to leave their house to play with their friends. So that also is contributing. The pressure to be perfect on social media is increasing in our young children. population. So that also we consider as a contributing factor. Less sleep, less good food, which means fresh fruits and vegetables. Children are consuming processed foods and fast food, and less physical activity due to all these factors can also be something we need to consider. Now we move on to the risk factors. As you can see, for a generalized anxiety disorder, we do have certain risk factors which predispose and contribute for children to develop more of that. And of course, one important factor is genetics. So there is a hereditary predisposition. So if the parents or other family members suffer from anxiety disorders or have depression or other mental health problems, then children are likely to develop that. And of course, the brain chemistry, the neuroticism, which is the personality trait, uh, for each specific child, negative cognitions, how much trauma they have faced in their life. There will be more anxiety if they have environmental factors impacting that, which includes exposure to domestic violence, physical abuse and neglect. It could also be reflection of learned behavior from the sibling or anybody they are observing. Now the family is struggling with financial issues, substance abuse that is going to compromise parenting capacity, and they are unable to support children and affects the attachment with the young person. And of course, dietary and schoolwork and bullying and stress are some of the other risk factors contributing to um, anxiety. Now, I think in our clinic we see a lot of patients, and I'm sure you also see these kind of presentations. But we should think about anxiety whenever a child is presenting with increased irritability and behavioral outbursts. Um, they may complain of, sore tummy or can have some physical symptoms leading on to vomiting, headaches, muscle pains, shaking, dizziness. They may feel palpitations or have fast breathing. So these are some of the common symptoms of anxiety in children. They may present with impact on their academic performance, where they are struggling with their schoolwork, are unable to complete it, and they have difficulty concentrating at school. Um, it may also reflect as separation anxiety, which means that they are have lot of clinginess to the parents or emotional outbursts, especially at school drop-offs. It may also reflect as difficulty in sleeping. So they may wake up or they would prefer to sleep with their parents. They are constantly worried or they are avoiding certain places or activities if they are anxious. And I think in these situations, you also worry about any sensory predisposition, because in children, if there is any sensory issues, that will contribute to increasing their anxiety. And that is common in children with neurodevelopmental problems as autism. As you can see, the signs of anxiety, there is a picture in the presentation as well, which just briefly summarizes all these symptoms. Now, common childhood anxiety disorders, especially in younger patients less than 12 years, can either be a social anxiety disorder or a separation anxiety disorder, followed by obsessive compulsive disorders, phobias. And of course, you can link anxiety as a part and parcel of other neurodevelopmental problems which we encounter in children commonly as ADHD or autism spectrum disorder. Now, as clinicians, it's really, really important that whenever we are considering um, diagnosis of generalized anxiety disorder or anxiety in a very young child, we need to be very thorough with our clinical evaluation. because there can be some differentials which may present as anxiety or may contribute or make the symptoms of anxiety worse. So always consider iron deficiency, hypothyroidism, lead toxicity, poor nutrition, any food sensitivities, and of course, family dynamics and environmental factors contributing to the symptomatology. Whether there is any element of mental health issues. Of course, bipolar is very rare in younger patients, but anxiety and depression children also can suffer. Of course, ADHD, ODD, fetal alcohol spectrum disorder, sleep apneas, and upper airway obstruction are few of the other differentials to be considered. And as our primary care providers and GPs, which are the first point of contact for families and children with these problems, our GPs are really thorough with their clinical assessment, and most of the referrals which we get, they have been already investigated for any underlying, cause by having all the pathological tests completed. So now we move on to the approach. How do we approach a patient or a child which we are considering a diagnosis of anxiety? I think first thing is history, making sure that we are doing all the details of the behaviors the parents are concerned about, and of course, what are the contributing factors and any risk factors which we can tease out right in the beginning. Um, Next thing is observation, because we do have that opportunity of seeing the patients in our clinic settings where we can get a fair bit of idea how the parent-child interaction is, whether the child is showing any signs of trauma, or they are over friendly, or they are showing some tantrums in our clinic settings. I think I had a patient in recently in my clinic, a young girl who was 5 years old, but was very clinging to the foster carer. So that actually indicates some sort of, attachment issues, and they are craving for some secure attachment with the carer. So those kind of observations are really, really crucial when we are evaluating these patients. Once we have done thorough history, we move on to the examination where we do record the height and weight of the child, make sure that we are not missing any um, growth abnormalities which may be accompanying. A thorough systemic examination head to toe, which we need to be opportunistic with children, is also something very helpful to do. So we just basically are considering a step-wise process, and have a very structured approach to these patients. Um, Next thing is investigations, screening for all the differentials which could help or contribute to make the symptoms worse, in especially iron studies, thyroid function tests. Um, we want to know the full blood count, vitamins, and celiac serology as well. Now, sleep is something which I particularly want to emphasize, because, especially in young children, it is not only the quantity of sleep which is important, but it is also the quality. Lot of neurodevelopmental problems, they get worse if the child is having sleep issues, and and I would say that anxiety is one of them. So a child going to be more anxious if their sleep is suboptimal. So always it is a good idea to ask specific question about sleep, especially the sleep routines. Second, how much screen time they are using around bedtime. Third, their behaviors around sleep, whether they are happy to sleep in their own room or whether they are constantly coming to the rooms of the parent. Um, Another thing is snoring. So that indicates or give an idea about the quality of sleep, because if they are constantly snoring, or they are mouth breathing, or they have got severe allergic rhinitis, that is going to affect their sleep. They may wake up tired, and that may make their existing anxiety much worse than it is. So it is really important as a clinician for us to address some of these things which we can correct. And for that, we can arrange a referral to a ear, nose, throat specialist to evaluate it, and or organize a sleep study. And that's what we commonly end up doing in patients who have got anxiety and sleep problems, or where we are actually suspecting that the sleep is impacting or making the symptoms worse. Of course, once we have done the basic workup, the next thing is we want to identify using certain checklist or questionnaires which may help. I'm sure GPs are much more familiar with the questionnaires they use to screen young people with anxiety. So, for example, strength and difficulty questionnaire, it could be SPAN's anxiety scores. And of course, depending on the age of the child, we need to be giving them questionnaires which they can relate and answer. And some of the questionnaires parents can support and fill. Now, once we have worked up the patient appropriately and we have identified the contributing factors, we are doing all these assessments to ensure that we can provide quality care to our clients, and we move on to the management. So, management, as you know, for any condition, especially which is neurodevelopmental in origin, which is impacting their behavior, is causing the anxiety and affecting young people, it's really important to work cohesively and collaboratively. And I'm very proud to say that we get a lot of support from our GPs and our colleagues who in managing the patients as a team. So it is a collaborative teamwork which we need to do for our young patients. And that is exactly how we manage anxiety disorders also. So in terms of team workup, as you can see, we may involve subspecialist, which could be an ophthalmologist or an ear, nose, throat specialist, or a clinical psychologist. There could be a observation of trying to get an assessment of behavioral phenotype, observing their cognitive, language, and social skills. If the child is at school, it's very helpful to get the perspective from school. And if they are linked with a private psychologist, we can also get their perception, because it is really important in children to get um, collaborative approach and take opinion and thoughts of other people who are involved, so that we can figure out whether the symptoms are there in one setting or they are present in multiple settings. So the counselors also help us to take detailed psychology, or the psychologists, they help us to take detailed family and school environmental factors which could be causing the stress related problems. Yes, in some cases, after referral to the pediatricians, the next step is to involve a child psychiatrist. And if we are worried about, extreme amount of aggression or underlying mental health problem, as depression and anxiety, and in Central Coast, we are lucky that we do have under 12 camps team, which Olivia will let us know in a short period of time, and other support services which are available. We do have facets also for behavioral management strategies and support to the families, which the children can be referred to. It is also very important to remain in touch with school to get an idea about their cognitive capacity, because sometimes the anxiety in young person is coming because of their inability to do their schoolwork. So, getting an idea about their cognitive capacity and providing support at school, or linking them with appropriate, um, support class placement is also very helpful. So again, few of the things which we can also do as a comprehensive management for our patients is, if we identify that there is sleep issues, we emphasize on the sleep hygiene, making sure screen time is limited. As you know, a screen is not very conducive to good night's sleep, so it should be 2 hours away from the bedtime. And if we feel that the sleep can be improved by use of melatonin, which is more natural supplements, then of course we do offer that. It's always a good idea to give some options about improving dietary practices, avoiding packaged foods, added sugars and colors, and increase the number of fresh fruits and vegetables, and also water instead of fizzy drinks in child's diet. Now, some of young children who are presenting with physical symptoms like tummy aches, headaches, or palpitation, they can be guided by their psychologist who is involved, or the behavioral therapist who is involved, to practice daily mindfulness to slow down. They can use the social media to have us download a Smiling Mind app or a bedtime explorer podcast, which may helpful to help them manage some of their anxiety symptoms. Encourage children to label or quantify their emotions using an chart, drawing, and coloring, which may be more age appropriate for young children, especially less than 12 years of age, because sometimes children find it really difficult to express their emotion in, you know, as one is to one. So they may use some other tools like charts, or use art and craft to express how they feel. And since we work very closely in partnership with schools, it is really helpful to encourage parents to talk to the child's teacher about what is going on, and to ask them to allow the child to take more regular breaks in the classroom if it is helpful, because school also needs to work in partnership, and all the plans need to be communicated to the school so that they are also able to support young children in management of their symptoms. And of course, we try to engage a child and find a positive activity for them, so that they can do that to divert their mind, which could be art and craft or sports. And as exercise is a great way of releasing serotonin and helps with relaxation. So we do encourage good physical activity for them. And of course, we do need a light health support in form of psychologist or behavioral therapist. And we have facets in Central Coast which provide it in the public system. Referral to the pediatricians, both in the private and public system, is an option for our colleagues, so that we can, help these families and escalate it to child psychiatrist as required. And last but not the least, there is option of using anti-anxiety medications, which I would consider to be the last resort, because with the anti-anxiety medications, it is always tricky. One, it is trial and error. Second, you have to manage the side effects. But I think it's really, really important to address these symptoms in young patients, especially less than 12 years of age, because once the puberty sets in, there are a lot of hormonal changes, and that may exacerbate some of these symptoms and lead on to negative thoughts, suicidal ideation, and it becomes more tricky to manage a young person, an older teenager with anxiety and depression, than it is to manage a young patient. But I think it also requires the parents to be insightful and be aware and supportive of this process. So I think at the bottom of it is support. So the child and young person should get as much supports from all the settings they are spending their time in, which starts from the family, and then is the school, after school care, or the leisure activities or fun activities they are involved in, and of course us as their clinicians, They get support from their primary care providers, and once they are referred to us, then we also provide them ongoing support. So children need that support to overcome anxiety symptoms, and it is a very important part of management. So I would just like to conclude my presentation by giving, um, I think, the message around early identification of these symptoms, because they have got long-term implications, as we have just discussed. Trying to determine an underlying medical etiology or environmental factors is extremely important, because we need to be very comprehensive with our assessment, so that whatever we can correct medically or in terms of family dynamics, we are able to support prompt provision of a rehabilitation or support services. So we need to arrange appropriate referrals to the services which are able to support young children with that. And being an advocate for parents and caregivers and helping them to advocate for the rights of their children is extremely important. So with that, I will finish my presentation. There are few references which you can go through. And thank you so much for attending the session today. Hope it was helpful.
We'll just wait for Olivia's webcam to load, and then she's going to do a little quick chat on CAMS. And we have had quite a few questions come through, so please stick around for those.
Yeah, sure. Thank you.
Hi, everyone. Can you see me, Sydney?
I can't see you. Your chroma cam's still loading, but it's almost there for everyone. There you go.
Okay, here we
Gotcha.
go. Well, thank you, Mina. That has been amazing, amazing presentation. Thanks, everyone, for registering tonight. I just want to briefly, again, as Dr. Ratan has said, that CAMS will support the GPs with young persons under 12s experiencing anxiety. Just briefly, again, to remind everyone about the pathways to refer to CAMS. There's two pathways at the moment. One of them is the important one, or the fastest one to get to CAMS, is via the GP. There's a special referral form that our awesome colleagues at PHN have uploaded. And as Dr. Ratan mentioned earlier in the presentation, it is really important that we explore symptoms, environment, any differentials. The referral form will give you an indication about what to add on it, and then this way, when we get the referral form, we can just at a glance be able to develop a picture, get a picture about what's happening with that young person, and go from there. The other pathway, of course, is via ED, but I would ask a few people to please consider carefully the ED option. Waiting in ED with a young person can be up to 8 hours. The process is for the young person and the parent to be reviewed by a pediatric registrar, who will then determine if there's any mental health concerns to refer back to the mental health registrar, which means another waiting period, another triage before a mental health assessment and a referral is completed. It is not optimal, a wait time in ED for a young person and the parent for up to 8 hours. That's why I would ask you to consider that pathway very seriously, only if the risk is very high and you cannot see any other options but to send the young person and the parent to ED. A couple of other little services out there. In case CAMS is not really the best service for the young person, there are other support services in the community, like BEAM services, Calm Kids. There's a few other services for the under 12s. Please don't hesitate. Give me a call. My mobile number is on the PHN, PHN Health Pathways website. I'm happy to send all this information out to you guys. I've also recently been made aware about another service out in the community run through by the Uniting. It's called Family and Carer Mental Health Programs. Again, as primary health providers, our GPs in the community have got an amazing, amazing, amazing job they're doing with parents and with young persons and their families. This support service will offer support for parents that can care for any person, young or old, that's got mental health concerns. There's no wait list. It's a free public service and they do amazing work. Please contact me and let me know, and I'm more than happy to send out all this information and let everyone know about what is available in the community apart from CAMS. Thank you, everyone, and I'll hand over back to Sydney and the questions from anyone.
Thank you, Olivia. Now, first question tonight we had come through was, would you recommend blood tests in all children with anxiety or just those on the severe end?
I think it depends on the evaluation by the GPs. If they find that there are significant symptoms of anxiety, it will be a good idea to investigate by doing relevant blood tests, as we discussed. But if they have figured out that the child is having some other contributing factors or has mild symptoms, of course, they don't need blood tests. So not each and every patient will require blood test for that. So it is basically on clinical acumen and clinical discretion of the GPs.
Perfect. Now, next one, if vitamin and celiac disease testing has not been performed by the primary care physician, do you perform these tests on all of your patients with suspected anxiety disorder?
I think if the patient has been referred to us and we have suspicion that there could be some contributing factors medically, uh, which may be evident from their dietary history or maybe from their sensory needs, because some of the patients which we see, they have texture preferences and they are limiting or restricting the type of foods they are taking. So we do include some of these investigations in those specific group of patients, or they are presenting with constipation or bowel issues, and we are worried about food sensitivities or celiac, then of course those investigations do get added up in our list for workup.
Brilliant. Next one is, why is melatonin the first line medication for children in anxiety?
Okay, so the melatonin is basically for sleep problems. So I wouldn't say that it is a management of anxiety. Melatonin is important for sleep, especially after you have corrected the sleep. Um, Make sure that you have emphasized the sleep hygiene measures, or you can you hear me?
Yep.
Yeah, sorry. So if you have ensured that the sleep hygiene is appropriate and the screen time is done and parents are still struggling with child not sleeping, then you can consider sleep. For sleep, you can consider melatonin. So it is an indirect way of ensuring a good night's sleep, which will decrease the severity of symptoms of anxiety. So it is not per se a management of anxiety, but it is definitely a management of sleep problems.
I relate to that one. I have 3 young kids, so melatonin is like, the gummies are very lovely, but only in
Yeah,
small
and
doses.
and I think I have been told by my patients that iHub offers some relatively cheap options, and parents are more receptive to natural supplements rather than
Mhm.
medications. Yeah.
I do find that they are very moody the next day, though, so it's a very small thing that we include when necessary. Next
Yeah.
one, we have question to Dr. Ratan. How do you feel about GPs starting anti-anxiety in patients in early teens? It's not accessible for many of my patients to see pediatrician, pediatric psychiatrist, or even a psychologist.
I can completely relate to that question because, there is increasing demand and GPs are very competent to assess which group of patients need support with anti-anxiety, antidepressant, especially where they have limited supports available. Of course, ideal world, we really want them to get all the supports which they need, especially the psychologist, because with medications, there is always, as I mentioned, trial and error. Parents can have some limitations of starting that, but if that is the only possible way, I think our GPs usually start anti-anxiety, antidepressant, especially in older age groups. I have seen some patients being started on that, and again, depending on the clinical discretion, if that is the only option, then I'm sure GPs can easily consider that.
And last one that we have here, oh no, we got another big one. Next one we have is, how do we refer to you specifically?
To myself or
To
pediatricians?
you yourself specifically, I believe.
Okay, so I work in Central Coast in Wyong, in the public system. So if you want to make a referral to myself, you can address the referral to me, which gets triaged, and being a public system, depending on which clinician has availability, they may get linked with any one of us. But if you want the patient to be seen by me in private, I do practice in Central Coast, both at Wyong and Gosford, and of course, then referral can be made by name to myself in those settings. So that is up to the GPs where they want to refer the patient to.
Perfect. Now the next one, Olivia, I think will be more for you. So if you want to turn back on your camera, I'll start to read it out. So it was just to share experience in their area. The CAM service is not very easily accessible. One patient is deemed stable after crisis presentation in ED. They would be referred back to the GP to refer the patient to psychologist under MHCP. But there are hardly any BB service for psychologists, and under 12s are not eligible for Headspace. For non-crisis issue, many times referral for psychologist support by CAMS were rejected.
Look, I understand, Sydney. Unfortunately, CAMS have got a strict criteria, whether it's the under 12 team or it's the 12 to 18. We work on what we term as moderate to severe mental health concerns with acuity and risk. Sometimes a young person can present to ED with a situational crisis and have suicidal thoughts, but once the crisis eases, these thoughts will recede and then things will go back. I understand that there is very limited number of psychologists in the community that will look after under 12s. That's why we have other services out there like BEAM, BEAM, or Calm Kids Central. They can offer up to 22 free psychology sessions for the under 12s. Just give me a call or contact me or email me, and I'm more than happy to send you out the details. Look, if you are in doubt as a primary health provider, please don't hesitate. Give me a call. You can also discuss the presentation on the phone with me. If there's any changes, we are more than happy to take the young person over again and provide a support service. However, we have to operate on the maintain our criteria, which is moderate to severe mental health concerns. If the young person is not suitable for us, I will usually, especially referrals that come from GPs, I will usually make sure that I can offer the parents other contacts and other supports that can link that young person to. I understand finances are difficult. Psychologists are difficult to find in the community, but please, the services are out there. Contact me and let me know, and I'm more than happy to guide you or to guide the family.
Thanks, Olivia. Now we did have a question asking for the places, a list of the places that we can refer to. Would that be something that you and I can do via email, that you can construct something? And I'm happy to upload it to our education library along with a copy of everything from today, as well as I can email it out to the attendees from today. So you can check your inbox once we've created that.
Absolutely. We can put together a list of services for specifically for the under 12s that we can either send out to everyone that's been attending tonight or put it on health pathways, whichever way is convenient for the GPs. But you always have the option of calling me. I work Monday to Thursday. I'm always available on the mobile number that's listed on health pathways. Leave a message for me. If I'm unavailable, I will always call you back. Those of the GPs on the Central Coast that have had contact with me know that I'm always contacting the GPs with outcomes of assessments or outcomes of referrals. If I understand you're busy, I will always forward an email, and then you'll be more than welcome to call me at your own leisure. But we certainly will put something together with the services, especially for the under 12s, and send it out.
Yeah, I think that's a great idea. And then we had another thank you. They'd really like that. If there are no other questions coming through, we will take an early mark. Oh, it looks like Beam still charges $110 to $130 for a gap. Is that correct? Do you know that, Olivia?
Beam services.
This is Gordon here. Can you hear me as well?
Yes, we can.
I think yeah, sorry. Okay. Through the Beams site there, they actually have a program called Little Sparks. Little Sparks itself is under the government funding at the present moment because they actually have got a contract with them. So therefore, if you are enrolling in the Little Sparks program, that should be under government funding, and you do not need to have a GP mental health care plan for the young person. However, if you're going through Beams directly, then that's where you may have a gap fee charged to yourself. So yeah, that helps you out.
Yeah, got good feedback from that one. Thanks, Gordon. And again, anyone can unmute themselves at any time during this and join in and have a question. And if you don't and you come up with any more, please, like Olivia said, just send it to us via email. We will put her email as well on the Education Library so that you can have that contact with her phone number, just if there are any other questions that come up for CAM Central Coast. Now, I think that was everything for today. That was wonderful, Dr. Rattan. Thank you so much. And just a reminder, when you exit out of the webinar, you will have the evaluation. It will ask you again for your RACGP number as well as your full name listed with RACGP, so I can upload them myself manually to my dashboard. But thank you all for coming.
Thank you so much.
Thank you, Sydney. Thank you, everyone.
Thank you.
Thank you. Have a good night, guys.
Good night.
Bye. Good night.